Assalamualaikum and hello everyone. Today my group and I will present about elbow and wrist injury. I will present about elbow ligament injury, which is LCL and MCL. The elbow joint has three ligaments that connect the upper and lower and provide stability and range of motion. The lateral collateral ligament of the elbow is the ligament on the outside of the elbow and not to be confused with the LCL in the knee. The LCL in the elbow is sometimes also called the radial collateral ligament, which is RCL. The ligament can become sprained or torn as a result of a sport injury. LCL has an important role in supporting the elbow. Injury can lead to elbow instability. Elbow lateral collateral ligament injuries are usually caused by fall or an outstretched hand. If you dislocate the elbow as a result of the fall, the LCL may tear. A less serious fall can still cause a LCL sprain. Other than that, it also because of overuse muscle of the forearm. In general, elbow injuries LCL occur. Most ligament injuries are most common in this sport, which is tennis, softball, and golf. The most common symptom of lateral collateral ligament injury is pain of the outside of your elbow. You may also notice a pain that extending from the elbow to the wrist. The pain usually associated with a gripping movement of the hand. At first, you may just experience pain when playing sport. As the condition progresses, you may experience pain all the time. The lateral collateral ligament complex contributes to varus and posterolateral stability. The LCL consists of three main parts that have been shown to contribute in some measure to elbow stability. The lateral ulnar collateral, which is LUCL, radial collateral, RCL, and annular ligament. These structures have more anatomic variability and are sometimes difficult to distinguish compared to their medial counterpart. The LUCL serves as the primary restraint to posterolateral rotatory instability. Overall, LCL complex remain taut throughout the range of motion of elbow flexion and extension. Your elbow joint is a joint that made up of three bones. The upper bones, which is humerus, and the two bones in the forearm is radius and ulna. There are bony bumps at the bottom of the humerus called epicondyles, where several muscles of the forearm begin their course. Muscle, ligament, and tendon hold the elbow joint together. Lateral epicondylitis involve the muscle and tendons of your forearm that are responsible for the extension of your wrist. First, you may start with the ankle above the elbow and the below of the elbow. Then you do the same crisscross technique. As you finish the crisscross technique, you close it off with the anchor. The medial collateral ligament, which is MCL, of the elbow is a part of the complex of ligaments and tendons that attach and stabilize the bone of the lower and upper arm where they meet at the elbow joint. It should be not confused with the MCL of the knee, sometimes also referred to as the ulnar collateral ligament, which is UCL. The MCL of the elbow attach the ulna, which is, along with the radius, makes up the bones of the lower arm to the humerus and the bone of the upper arm. In most people, injuries to the elbow MCL are rarely caused by stress inflicted on the joint during a throwing motion. But for athletes such as baseball pitchers, javelin throwers or lacrosse players, the forceful repetitive motion of their sport can cause inflammation or swelling, cartilage injuries, bone spurs, or even a tear in the ligament. The symptom is the players will not be able to exert significant force into a throw. In some cases, it may not be immediately clear that ligament has been torn, but some people can hearing a pop at the time of injury. The elbow joint is where the bone in the arm meet. The upper arm bone is humerus and the two bones in the forearm is radius and ulna. It is a combination hinge and pivot joint. The hinge part of the joint lets the arm bend and strengthen. The pivot part lets the lower arm twist and rotate. During the throwing motion, the olecranon and humerus bone are twisted and forced against each other. Over time, this can lead to valgus extension overload, a condition in which the protective cartilage on the olecranon is worn away and abnormal overgrowth of bone called bone spurs or osteophyte develop. Athletes with valgus extension overload experience swelling and pain at the site of maximum contact between the bone in the back part of the elbow. First, do the double anchor on above and below of the elbow. Second, start with a crisscross, then do a doubling tape. After that, do a straight down the tape, and then you do a 3 strap.
Next, I will explain about carpal tunnel injury or carpal tunnel syndrome. Carpal tunnel syndrome, also known as median nerve compression, is a condition that causes numbness, tingling, or weakness in the fingers and hand. It occurs as a result of pressure on your median nerve, which runs the length of your arm, passes through the carpal tunnel in your wrist, and terminates in your hand. The median nerve regulates the movement and sensation of your thumb, as well as the movement of all your fingers except your pinky. Next is about the movement of wrist. The wrist is a complex series of joints that are formed around the carpal bones and the radius and ulna at the forearm bones. The wrist is capable of 3 sets of distinct movements, which are flexion and extension, supination and pronation, ulnar deviation, and radial deviation. Symptoms of carpal tunnel syndrome may include numbness, tingling, burning, and pain. It primarily can feel near the thumb and index, middle, and ring fingers. This often wakes people up at night. Next, occasional shock-like sensation that radiate to the thumb and index, middle, and ring fingers. Pain or tingling that may travel up the forearm toward the shoulder. Then you can feel weakness and clumsiness in the hand, and this may make it difficult to perform fine movements, such as buttoning your clothes. Other than that, dropping things due to weakness, numbness, or a loss of proprioception is also one of the symptoms of carpal tunnel syndrome. In most cases, the symptoms of carpal tunnel syndrome begin gradually without a specific injury. Many people find that their symptoms can come and go at first. However, as the condition worsens, symptoms may occur more frequently or may persist for longer periods of time. Next, we move to the stage. There are 3 stages of carpal tunnel syndrome, where the first stage can be called a mild stage. In mild stage, people will feel the numbness or tingling at their hands. Next, the moderate stage happens when the median nerve inside the wrist become more and more damaged by swollen tendons. Carpal tunnel syndrome worsens. The hallmark of moderate stage carpal tunnel is when symptoms start to appear during daytime hours instead of only at rest. Also, people may begin to lose the sensation of hot or cold in their fingertips. And the last stage is the severe stage, where the condition progresses to the severe stage. Your hand function dramatically deteriorates. A person's daily life is dominated by a general loss of grip strength and dexterity. The hand is clumsier and weaker than it has ever been. Next is causes of carpal tunnel syndrome. Most cases of carpal tunnel syndrome are caused by a combination of factors such as heredity. This is likely an important factor, where the carpal tunnel may be naturally smaller in some people, or there are maybe anatomic differences that change the amount of space for the nerve. For example, these traits can run in families. Next, it is because of the repetitive hand use. When repeating the same hand and wrist motion or activities over a prolonged period of time may aggravate the tendons in the wrist, causing swelling that puts pressure on the nerve. Other than that, hand and wrist posture, excessive flexion or extension of the hand and wrist for an extended period of time can increase pressure on the nerve. However, pregnancy also can be the cause of creating carpal tunnel syndrome. It is because hormonal change during pregnancy can cause swelling that result in pressure on the nerve. And the last one might be health conditions such as diabetes, rheumatoid arthritis, and thyroid gland imbalance are conditions that are associated with carpal tunnel syndrome. We go to types of sports. Carpal tunnel syndrome is common in most racket sports: handball, swimming, bodybuilding, rowing, golf, archery, and rock climbing. but it can occur in any sport that requires prolonged use of the wrist and hand. Anatomy of wrist or carpal tunnel syndrome. The carpal tunnel is a 1-inch wide passageway in the wrist. The tunnel's floor and sides are formed by small wrist bones, known as carpal bones. The roof of the tunnel is a strong band of connective tissue called the transverse carpal ligaments. Because the boundaries are very rigid, the carpal tunnel has little capacity to stretch or increase in size. The median nerve is one of the main nerves in the hand. It originates as a group of nerve roots in the neck. These roots then come together form a single nerve in the arm. The median nerve travels down the upper arm, across the elbow and into the forearm, then passes through the carpal tunnel at the wrist on its way to the hand and fingers. It separates into several smaller nerves along the way, particularly once it reaches the palm. These nerves allow for feelings in the thumbs, index finger, middle finger, and half of the ring finger. The median nerve also controls the muscle around the base of the thumb. The 9 tendons that bend the fingers and thumbs also travel through the carpal tunnel with the nerves. These tendons are called flexor tendons because they flex the fingers and thumb. So for strapping carpal tunnel injury, what you need to do is have the person put their hand up and apply leg pressure onto your belly, keeping their hand in this position, and wrap their hand and forearm using an underwrap. Then starting 2 or 3 anchors at the top or forearm when their hands are in plate position keeps the muscle tense. Then do an anchor strip across the hand. Start from the base of the hand and cut across goes underneath and the back. Because of the size of the hand, we need to pinch the tape and slightly cross the tape to the back. Once we have the anchor step down, you want to establish which motion of restriction you are trying to prevent. If you are trying to restrict the extension motion, which is going backwards, you are going to apply strips of the tape on the palmar aspect. So in this situation, here we're going to prevent a motion of extension. Thus, our strip are going to be placed on the palmar aspect in flexion. So we need to measure the strip from the forearm to the knuckle anchor. And to each thing, you can find a separate location to make a few strips to make it look like a fan and place it to the palmar aspect. So to make it more good, I will do the fan for a few times. And I will place it there again. Then we can start doing the anchor from the forearm around 3 times. And before you do the anchor near the knuckles, check with the athlete if the restrict motion of extension is tight enough. If it is tightened, then end it with the anchor stacked across the hand. So here is the result of strapping carpal tunnel injury or carpal tunnel syndrome. Thank you.
Assalamualaikum. My name is Nurin Emelda Amani binti Muhammad Faisal. Now I will present about thumb dislocation. First, thumb dislocation is when the phalanx bones in a joint slip out of their normal position. The sport that familiar with thumb dislocation is like football, basketball, gymnastics, volleyball, or combat sport. Then, the movement of the thumb is consisting of 5 movements, which is flexion, extension, position, adduction and abduction. There are two types of dislocation, which is distal interphalange joint dislocation and proximal interphalange joint dislocation. Okay, for distal interphalange joint dislocation, it is occurred in the joints closest to fingertip. The location distal interphalange dislocation occur between the proximal phalanx bones and the distal phalanx bones. Next, for proximal interphalange joint dislocation, it is very common dislocation due to sporting activities that occur at the joint between metacarpal phalanx bones and the proximal phalanx bones. Second is volar dislocation, where the phalanx close to the fingertip is displaced toward the palm of the hand. This dislocation usually caused by hyperattention or hyperflexion injury. For example, the object hit the tip of the thumb. Then, the cause of the thumb dislocation is consisting of two, which is injuries during sport, such as fall, or due to an auto accident or collision during contact or high-speed sport. Second is injuries not in sport, such as vehicle incidents. The symptom of the thumb dislocation is when the victim feels crooked, swollen, bruised, or cut on the dislocation thumb. Moving the dislocated thumb is extremely painful and feel abnormally loose or unstable. Next, we move to the anatomy of the thumb. This is the comparison between a normal thumb condition and a dislocated thumb condition. After experiencing a dislocation, we can see that bone has completely came out of its position. For interphalange joint dislocation, we can see that proximal phalanx bones came out of its position. Either it can be distally or volarly. At the same time, for distal interphalange joint dislocation, we can see that distal phalanx bones came out of its position. During injuries, this joint cannot perform flexion and extension movement because it is consisting of hinge joint that allow only flexion and extension. Also, upon axial loading and hyperextension of the thumb, the volar plate that act as a stabilizer and thick ligament that connect to bones in the finger may be tears. Lastly, some people might experience stress of muscle, blood vessel, and other tissues around their thumb when dislocated. So next, we move to thumb dislocate strapping video. First, apply strapping tape around the wrist. This will act as anchor. Second, apply strapping tape from the medial joint of the thumb down to the ankle to provide support. Then, repeat 3 to 4 times for larger thumbs. Apply strapping from the ankle on the wrist up to and around the midpoint of the thumb with further pressure applied when coming back to the back of the wrist. Repeat twice or 3 times for larger thumbs. Lastly, finish technique by securing an anchor around the wrist.